This is Dr. Ron Valdesari coming to you from the 19th Conference on Retroviruses and Opportunistic Infections, otherwise known as CROI, and I'm joined here with my good friend and colleague, Dr. Jonathan Merman, who's the Director of the Division of HIV/AIDS Prevention at CDC. And Jonathan, there have been so many important scientific pieces of information presented here. It's hard to pick out the ones that are most significant, but would you like to share with our viewers what you think have been some of the most significant findings from this meeting?
Well, the main finding for me is that the conference highlights the importance of the scientific method. Whether it's applied science, basic science, or operational research, multiple different studies have moved us forward closer to the time when we can see an AIDS-free generation, when we can make sure that everyone who is eligible for antiretroviral therapy is receiving it, and that ultimately HIV is, the epidemic is reversed in both the United States and international.
What can you tell the viewers about what we've heard about PrEP at this meeting? And of course, you know that PrEP refers to pre-exposure prophylaxis, but share with the viewers some of the findings we've been hearing about PrEP.
Well, PrEP's been a major topic of the conference this year, and there have been some results from some studies over the past couple of years that have indicated that it has worked, generally by reducing acquisition by between 44 and 73% among gay and bisexual men, among heterosexual men and women. However, there have also been two studies where it was not effective among women, and the scientific community has been trying to grapple with what enabled PrEP to be effective in some circumstances, in some randomized controlled trials, and not in others. And this conference added some more information to help people try to interpret that. To some extent, there's some good data that indicate that adherence to taking the medication itself was a major factor, at least in one of the studies, in why it didn't show an effect.
Exactly. And there are, as you said, other studies currently underway that will shed more light on this.
Exactly.
Great. So let's just end by asking, Jono, you referred earlier to an AIDS-free generation, and I know more and more, we've heard the President talk about that, we've heard Secretary Clinton, we've heard Secretary Sebelius refer to an AIDS-free generation. Just briefly, why don't you share with our viewers why we're hearing that more in 2012 than ever before in the epidemic here in the U.S.?
Mm-hmm. Well, in the past few years, there have been some scientific discoveries that have allowed the world to really envision the potential for us to reverse the HIV epidemic and really allow people who are growing up over the next decade not to acquire HIV. To some extent, that stems from the fact that we've found out that taking HIV medication reduces the chance that you're going to transmit HIV to others. So helping yourself to live a longer, healthier life also helps you not transmit HIV to others. At the other side, we have the pre-exposure prophylaxis. We have studies looking at other prevention modalities like vaginal microbicides, some early work with rectal microbicides, and other behavioral interventions that really bringing to scale testing, linkage to care, retention in care, and ultimately suppressing virus among people with HIV, and prevention efforts among people who don't have HIV to help them stay HIV negative, could potentially reverse the epidemic. And so the scientists are figuring out exactly how we put all that together in the most effective way to end up leaving us with an AIDS-free generation.
Thank you, Jono, for sharing your thoughts with us. I want to remind everyone, if you want to learn more about this meeting or anything related to HIV/AIDS, please visit AIDS.gov. This is Ron Valdesari from CROI.